Good morning. Good morning. Good morning. I am excited. We're here to talk about men's health, and with me today, I have my esteemed colleagues, which includes Senator L.G. Sims, Senator Napoleon Harris, and Senator Robert Peters. The inspiration for this panel came from Senator Simmons' bill, House Bill 4589, which creates a men's health division within the Illinois Department of Public Health. House Bill 4589 directs IDPH to create a division of men's health to raise awareness of health issues, particular to men that are not currently or adequately addressed by the department, including prostate cancer, testicular cancer, smoking cessation, heart disease, and mental health. So without any further ado, let's just jump right in it. And this question is to the panel. Question, why are Black men so hesitant to go to the doctor?
I'll start that off, Senator Belt. Just to start that with that question, why are Black men so hesitant? When you think about our community, Black men are being trained to be strong, to be leaders, to not cry, to not show emotion, to be inspirational, and all those things that we deal with just being a Black man in our community. There's a fear that something could be wrong, because we always say, no, we okay, because we've been trained to have thick skin, to not process things as we need to vent and let them out. We compartmentalize and hold things inside. And that leads to that fear, that ongoing fear that I don't want to go to the doctor because of what potentially they can say that could be negatively wrong with me, versus saying, hey, I need to go to the doctor so I can make sure that there is nothing wrong with me, so that I can prolong my health and my life and take care of myself. And I think that we need to break down those barriers by continually to have conversations like this and to promote education in that space, and do the things that we all on this call have been doing with passing laws to make that access, that barrier, easier for Black men to be able to go to the doctor and be able to have that open dialogue with their primary care physician to talk about their health, to make sure that our communities are healthier.
Very, very good point, Senator Harris, you bring up, and we're all from different parts of the state, but I think it's safe to assume we all grew up knowing that, or with that philosophy that we can't cry, that we have to, you hurt yourself, you got to fight through it, and all those things. All those things take away from us going to the doctor and seeing what's wrong with us, and then we pass it on to our kids, and it's a perpetual type of thing. And you're right, we have to break it. What about the historical significance of our experience in this country relative to healthcare? You think that plays a part in anything for us staying away from the doctor?
Yeah, I'll take that, Senator Belt. I mean, you've got the historical issues and problems that we've experienced, and natural conspiracies that we've been subjected to with the beginning of the Tuskegee experiment, and those types of experiences have been relied on. And even as we've gone through the COVID-19 pandemic, trying to get people vaccinated, particularly and getting Black men vaccinated throughout that pandemic, a lot of folks relied on those conspiracies from the Tuskegee experiment to say, well, this is why I don't trust the healthcare system. This is why I don't trust government, because we've had these experiences in the past where when Black men have been subjected to experiences that have led to negative health outcomes. And then, building on the discussion that we're having in terms of who we are and how we are, you are seeing, trauma be passed generationally. We should be passing generational wealth, but instead we're passing generational trauma, because those things that you talked about, Senator Belt, in the opening, we've internalized those, and then we teach those behaviors to our children. And that's why, these kinds of conversations, I'm very glad that we're having this conversation, because it shows our desire and our ability to talk about our health differently. It talks about us being proactive about our health and being proactive about how we're going to be able to be here for our families, for our children, for our grandchildren. Because if we don't have these discussions, we don't have these very necessary, poignant discussions right now, then we won't be able to figure out and be here to establish those long-term impacts on our community.
Absolutely.
And if I can just add, I mean, so ProPublica did like a study did a story about how COVID broadly has been impacting Black men in terms of health, and particularly looking at the story of John Henry, and basically saying that when it comes to having to push through, right, a whole host of physical and emotional trauma, that Black men have often been pushed to the brink. When it comes to the level of investment in terms of healthcare, that Black men have been pushed to the brink, and that all that historical pain that the other senators have pointed out, really in the recent last couple of years and during this pandemic, have been particularly painful, and has been particularly deadly. And so when we think about, Black men and healthcare, we have to think about both the long-term systemic things that have existed, the barriers people have to go through to be able to, sort of meet the challenges that exist in life. And then the other one about this is that the sort of stereotype to get through those challenges that present an undue burden on someone's healthcare, right? And someone's health, their well-being. And so I think that ProPublica sort of digging in on the John Henry legend is, I think, a very important way to describe what we're going through right now, and over the last 3 years. And so to me, this is going to be, I think, the ultimate challenge, is that we have to think about this in the sense of how much we're going to invest in people's lives and their well-being. I mean, if you think about it, the combination of that trauma, and I know, I said to you before we did this, I'm trying not to talk too much, but the combination of things is that when you think about someone going through and living in a working class community, so Black men are more likely to be working class than almost anybody. At the same time, then more likely to face pressure and discrimination when it comes to education, when it comes to healthcare. Then at the same time, to meet more than anybody the levels of incarceration that are put onto folks. And then when you get out of that, not only depending on how your healthcare is when you're incarcerated, but when you come out of that, the barriers to be able to even lift yourself up in life, when it comes to healthcare, to jobs, to housing, those are all, you have to think about those as weights on your heart, weights on your arteries, weights on your shoulders, weights on your mental well-being. And so ultimately, I always think that this is constantly a fight to remove that weight, both inside ourselves, institutionally and systemically.